Okay, I received my doctor's orders, and I'm going to check them with my MAR. The medication the doctor ordered is going to be gentamicin 60 milligrams IV piggyback every 12 hours. And it's on the MAR. And I'm also going to be giving furosemide 30 milligrams IV push. It's on the MAR. I'm going to be giving the gentamicin. The rate is going to be 17 drops per minute. And the furosemide is going to be given over 1 to 2 minutes. For the gentamicin, I will be checking the labs. I will be checking BUN, serum creatinine, calcium, magnesium, sodium, potassium. I will monitor the urine output and the gentamicin serum levels. And for the Lasix, I will check the BP before giving the medication, and the patient's blood pressure is good, and frequently during treatment. I will check his electrolytes, blood CBC, and I will monitor him for dizziness, any muscle cramps, and instruct him to call for assistance with ADLs. Now I'm going to check my medication with the MAR. Furosemide, I have here furosemide on the doctor's orders, 30 milligrams. And my gentamicin, 60 milligrams for IV piggyback. The gentamicin is correctly diluted in 100 mLs of D5W, and the Lasix can be given undiluted. I will wash my hands and prepare my medication. I'm going to start with the Lasix. Clean the valve for 30 seconds. And I'm going to inject 3 mLs of air. Making sure there's no air bubbles in the syringe. Then I will label my furosemide with the patient's name, the medication, the amount, the prepared date and time, my initials, the expiration date and time. Three mLs of Lasix. Then I will label my gentamicin with the drug additive, which is gentamicin, the amount 60 milligrams, my initials, date and time, the expiration date, the patient's name, room number, start time, start date, the flow rate, which is 17 drops per minute, and that is in D5W, 100 mLs. I'm going to clamp my tubing. Spike my bag. And prime my tubing. Making sure there's no air in the bag. I'm sorry, make sure there's no air in the tubing. Now that I got my medications prepared, I've checked the expiration date, I've checked the bag for any particles, didn't see any, and the expiration date on the bag, which was good. I checked for medication allergies, correct dose, route, and rate of administration. I'm going to my patient's room. Hello, my name is Demetria. I'm going to be your nurse today. I'm going to give you Lasix, 30 milligrams, because you've been retaining a lot of fluid and have a lot of edema, by IV push. And I'm also going to give you gentamicin, 60 milligrams. It's an IV piggyback antibiotic that I'll hang because you're having some infection going on. Do you have any allergies to any medicines? My patient doesn't have any allergies. I will ask them their name and date of birth. Can you please tell me your name and date of birth, please? May I see your armband, please? Okay. And I will wash my hands and put on some gloves. And I will check the site for any signs of tenderness. Are you having any pain in this area? No. Any redness or swelling? I don't see any. I will lower my primary bag and look for flashback. I do have flashback, so the IV is flowing properly and it is patent. I'm going to give my IV push medication first. I'm going to clamp the tubing on the side with a primary bag. I'm going to clean for 60 seconds. And I'm going to push each 40 milligrams of fraction thereof over 1 to 2 minutes. I have 30 milligrams, so I'll push it over 1 to 2 minutes. Push pause, using the push pause method. Okay, the Lasix is compatible with the D5W that's already hanging, so no need for me to flush. I would teach my patient that the Lasix could cause dizziness or muscle cramps. Report any of those signs and symptoms to me immediately. And please use the call bell for assistance. I'm going to lower my primary bag. I'm going to clean the port closest to the primary bag for 60 seconds. Connect my piggyback. And I will open the piggyback. Calculate my flow rate of 17 drops per minute. No. No. Okay, stop. Once the medication is done, I will clamp off my piggyback. Disconnect it. Raise my primary bag and recalculate it back to the previous flow rate. I will leave my patients comfortable, bed at the lowest position, side rails up ×2, and wheels locked, and I would remind my patient to call for assistance. That's the end of my video.